Hello, brothers and sisters. I want again to welcome all of you to this lesson. Remember, in the last lesson, we talked about a brief introduction on hearing impairment. And in this lesson, I want us to focus on mental retardation. Mental retardation, in most cases, especially among the hearing community, they mistake mental retardation with madness. Remember, mental retardation is a disorder and it has nothing in common with madness. So we say, as far as this topic is concerned, of course we are discussing each of them in relation to hearing impairment. So mental illness is a general, of course, term for a group of illness that affect the mind and how the brain function. So this illness may include the following, and of course not limited to one, bipolar disorder. We also have depression. We have schizophrenia. We have anxiety and personal disorder. Remember, affect the way a person thinks, feels, and acts. All those ones that we have mentioned will affect the way the person thinks, feel, and acts. So those just are a few of some of the challenges or problems or disorders that result from mental illness. And remember that a person with a mental health condition may experience, of course, difficulties in concentrating. So these people will always have problems with concentration, which of course can sometimes be as a result of medication. So we have to be very careful, especially when we are taking medicines or during medication period. So remember, to avoid all this that we have mentioned, try to avoid stressful situations where possible, so that their condition can at least not be worsened. So any of these circumstances we have talked about, especially those of us who have these brothers and sisters suffering from mental retardation at home, make sure that you provide a conducive environment for them so that you don't worsen the situation. Remember, we are discussing this in relation to hearing impairment. There are those deaf people who also have a mental retardation or a multiple of disability. So we have to be very careful on how we handle them, of course with care and love, and also to avoid circumstances or situations that might worsen their mental illness. See you in the next lesson.